Hi. So if you're looking at this video, that means you or a loved one has made a tough decision. But it was the right decision for them. Your loved one is going to opt for hospice care. You know what that means, that the focus of things is going to shift now. What you're focused on now is helping your loved one live with their illness as comfortably as possible, to live as fully as possible, living in the way that your loved one wants to live now. That's what you want, and that's what you know. But what you don't know is, how is all of this going to get paid for? Okay, deep breath. That's why we're here. I promise you, this is not nearly as hard as it seems. We're going to get through it together right now. Let's be honest. The government can make this pretty confusing. They don't mean to, they're just the government. It's their job. Well, the good news is, if your loved one is medically eligible for hospice care, then it's almost certain that there's a way to pay for it. Most of the time, the way to pay for it is Medicare, and I'm going to explain exactly how that works. But while we go through that, remember, even if your loved one is not eligible for Medicare and has no other health insurance, there are other options. We'll talk about those too. But what we're going to do now, we're going to start with Medicare. I'm going to walk you through how hospice care gets paid for, what's covered, what's not covered, all that. You ready? Need to put me on pause and get a drink? No? Good. All right, let's get started. Okay, here we go. Medicare. This is so much easier than you think. Here's how it works. When your loved one turned 65, they became eligible for Medicare. They got one of these cards that's called Medicare Part A, and most likely they didn't have to pay for it. You see, everybody who paid Medicare taxes while they were working gets this for free, and so do their spouses. Up till now, this mostly covered hospital stays, but now, if you choose to, you can turn it into, ta-da, the hospice benefit. That's what they call the part of Medicare that pays for hospice care. You should know that term, hospice benefit. That's what you need. So what you're going to do first, you're going to choose a hospice care provider. The doctor can help you do that, or the nursing home. And I'm going to give you some questions to ask. The first question you're going to ask the provider is, do they take Medicare? Not to worry, most of them do, but ask that first. Now let me take a minute to remind you, if your loved one is not eligible for Medicare, as I said, there are other solutions. Private insurance, Medicaid, lots of possibilities. Many hospices will provide services even if the patient doesn't have insurance or any other way to pay for care. So don't panic. Talk to them first. Okay, back to Medicare. How do you get started? Here's the deal. The patient's personal doctor, along with the hospice doctor, will determine if your loved one is medically eligible for hospice. In other words, if the disease is at a stage where hospice is an option. Once they make that determination, that's it. That gets the ball rolling. Now the patient can get the Medicare hospice benefit. And just one more time I'll say, if your loved one is not eligible for Medicare and doesn't have other health insurance, there are still options available. You should talk to a hospice provider about that. Okay, now hang on. When they turn 65, your loved one may have opted into other parts of Medicare too, the ones you pay for. There's a whole alphabet soup of them. Part B, that's for doctor visits. Part D, that's drugs. And there's something called Medicare Advantage plans. Those are like those companies that do ads on TV. Those all cover other things. But let's not worry about those yet. Let's just talk about the Medicare hospice benefit and what the hospice benefit does cover. You're probably going to do the hospice care in a home. Your home, their home, and maybe their home is a nursing home or an assisted living facility, wherever. The hospice benefit covers the visits by your hospice team, including a nurse. It also covers the medicines that the doctor has prescribed for the illness that brought your loved one into hospice care to keep the patient comfortable. And it even covers medical equipment, like oxygen, if the hospice doctor orders it. And if the doctor orders a hospital-style bed, then that will be covered as well. The hospice benefit covers a lot more, too. But you don't have to write all this down. I'll show you where to get this list when we're done. Okay, now, what does Medicare's hospice benefit not cover? This is key. You need to know this. Once your loved one has chosen the hospice benefit, Medicare covers treatments that are aimed at making them comfortable, but not treatments for curing the disease. Let me give you an example. Let's say your loved one has advanced cancer. She's been getting chemo and radiation to try to defeat the cancer. Now she's decided to take a different approach, the hospice approach. The Medicare hospice benefit will not cover treatments aimed at curing the disease, but it will cover medicines that make her more comfortable. The point is, what we're talking about now is coverage for treatments to improve or maintain the quality of life. That's what's covered, and that's a good thing. There are some other things that are not covered. Room and board, for example. A lot of people think that's covered, but it's not. Are drugs covered? Again, only if they're ordered by the doctor to ease pain or to manage the illness that brought your loved one into hospice care. If that's the case, then you bet they are covered. Okay, time out. I want to say something, and I'm going to say it straight out. Some people think hospice means giving up. Well, those people are wrong. Those people don't understand how important it is that the time you have left with your loved one is quality time. It's going to be about talking together and spending time together and enjoying each other. Less running to the doctors, more living, pain controlled, symptoms managed. That's the beauty of hospice care. It's about living, not dying. And that's what the Medicare hospice benefit pays for. I just wanted you to know why this is set up the way it is. It's built around what you need now and what you want now. Okay, onwards, we're almost there. 3 more points you have to know about. 1, the decision to choose hospice care is not set in stone. You can change your mind at any time. You can opt out of hospice care at any time, and if you have Medicare, it goes back to the way it was before you chose the hospice benefit. You can come back to hospice care at any time, so long as you are medically eligible. 2, if your loved one develops a medical problem not related to the illness they're getting hospice care for, then Medicare covers it, period. Say they have cancer and have chosen hospice, but now they develop diabetes. The diabetes treatment and care are all covered by Medicare, separately from the hospice care. That's important to know. And now, there's one more thing I want to tell you about. It's called respite care, and this one's a little tricky. If you've ever cared for someone who's very, very sick, then you know how stressful that can be. So, say you're doing hospice care in the home, and you need a break because you're exhausted, or you want a break for a special occasion, like to go away for a wedding. Your hospice provider probably has hospice beds somewhere, a nursing home, a hospital, maybe their own facility. Your loved one can go there for up to 5 days at a time. How many times? How often? Well, that's the tricky part. It varies. That's something you should ask your hospice provider right up front. Ask, what's their policy on respite care? And that leads us to a very important point. You might think that if Medicare doesn't pay for something, then your loved one won't get it. But the fact is, that's not necessarily true. Some hospices are able to do more than they have to. You won't know unless you ask. Everyone in this is there to help you. They really are. Even, believe it or not, the government. I know it's hard to believe, but look, everyone involved knows you're in a tough situation, and they also know you love someone and they love you, and you want to spend the remaining precious weeks or months or more, you want to spend it together. Well, the hospice team is going to help you with that. I promise you. All right. I also promised you I'd tell you where to get more information. Now that you know the basics, I think you're ready. There are really just 2 pamphlets you need to look at, and you're not going to believe this, they're actually pretty easy to get through. The first is called Medicare Hospice Benefits. You'll find it on this website, medicare.gov. I'll give you a second to write that down. Okay, here's the other one. It's called Medicare and You. Again, you'll find it on the website, medicare.gov. This one covers lots of questions about who's eligible for what covers what, that kind of thing. So, that's it. I hope we helped. There are so many questions we haven't covered. Like, what's my loved one eligible for if they're under 65? What if you can't do hospice care in your home? Well, those booklets hold a lot of the answers. But here's a number you can call if you want to talk to someone to explain this some more. We just want to assure you that your money questions can be answered, so you can deal with what's really important, your loved one, and spending time together in the most meaningful way. I'm Kate Sullivan for the Hospice Foundation of America. From the bottom of our hearts, we wish you the best of luck. Thanks for watching.